So, you completed the Montreal Cognitive Assessment, which did not find any significant cognitive problems.
Absolutely.
I also had you take some time to fill out the Pittsburgh Sleep Quality Index because I wanted to make sure I wasn't missing some other cause of sleep disturbance. And it was great that you were able to check in with your husband to see if he had noticed anything like snoring or leg stroking, which he hadn't. So I'm less worried about things like sleep apnea or restless leg syndrome being a part of the picture. You also completed the menopause rating scale, which reflected the problems we talked about before. This scale also showed that you've been having more anxiety, irritability, and lower mood. Can you tell me a little bit more about those feelings?
Well, for the last 2 months, I have felt extremely irritable and moody. I'll feel better for a few hours, and then all of a sudden, I'm irritable again. I just find myself feeling really impatient and overwhelmed, and honestly, I just want to escape from it all. Sometimes my family looks at me with raised eyebrows, and I can tell they're surprised by my angry tone of voice. Weekends aren't any better than during the week. I just have so much to do, and I don't want to do any of it. I think to myself, how did I get into this mess? I'm not enjoying anything, and I'm not looking forward to things. I just want everyone to leave me alone.
So there can be a lot of stressors at this time of your life. And why don't you tell me a little bit more about the things you worry about and the list of things you have to do on the weekends?
Well, my parents, for one, there's a lot to do for them. They're in their early 80s and they need their meals cooked now, and they also need a lot of help getting to their doctor's appointments. My father doesn't walk well anymore, so I really worry about him falling again. My brother lives near them, but he seems so stressed out with his divorce and his job that I haven't asked him to help, but I'm not sure how much I can juggle this all on my own. And then there's my daughter. She just started college nearby, but she's having a lot of stress in her first trimester, her first semester. She wants to come home every weekend and entertain her new friends or study or get her laundry done. It's easy because she lives nearby, but it's a lot of work because it's hosting people or letting her vent, although I do like to see her. My younger son is applying for colleges right now, so I'm trying to help him stay organized. I'm reading all of his essays for his applications, so that whole process is pretty stressful. Then at work, I've been moved to a leadership position, which I like, but there's just been a lot to do. We have 2 nurses out on leave right now, so I've been trying to help fill in with the day-to-day work that needs to be done on the floor.
That does sound like a lot. So how are you doing with taking time for yourself and taking care of your other medical needs? Have you been seeing a primary care doctor?
I really haven't been that good about that. It's just been so hard to find the time. I know I'm overdue for my mammogram. I should go back and make sure that levothyroxine that I started 6 months ago is at the right dose. But honestly, it just doesn't seem like there's any time for me time. I was feeling better when I was going to the gym regularly, but then my knee started hurting and I haven't run in 2 months.
I like that you're thinking about these things. If your hypothyroidism isn't fully treated, that could definitely be contributing to your symptoms. And it sounds like exercise has been helpful for you in the past in improving your mood. So we know that things like obesity and smoking can be risk factors for hot flashes. So it's important to maintain your overall physical health during this time period. We can get some basic blood work done today to make sure there's nothing we're missing. Does it feel like you're coping differently with problems than you have in the past? How similar does this feel to the postpartum depression you had in your 20s?
I mean, it does feel like I'm just not handling things as well. I feel guilty about that, like I'm failing everyone. I'm not as severely sleep deprived as I was when I was postpartum, but it does feel similar in terms of the irritability.
So, and I understand you're sleeping about 4 hours due to waking up early. Are you having any reduction in your sleep because you feel too wired or have too much energy? Or have you ever had any symptoms such as increased energy lasting at least 2 days with talking faster, overspending, doing more, taking risks, or feeling much more confident than usual?
No, nothing like that now or in the past. Honestly, I'm exhausted all the time. If anything, I've been taking fewer and fewer risks. I just feel like I want to hibernate.
So with poor sleep, stress, and low mood, some women also have unusual experiences, such as hearing a negative voice when no one is there, or feeling like you're being followed or that others want to harm you. Have you ever experienced anything like this?
No, I haven't heard anything like that. I mean, I worry about bad things happening, but it's not that it's talking to me or anything like that.
So let me pause for a moment to ask you about your alcohol use to see whether that might be playing a role. You said you've been drinking 1 to 2 glasses of wine 4 to 5 nights out of the week. How long has that been the pattern for you?
Probably about the last 6 months or so. A glass of wine really helps me relax after work, and I've been adding that to my regular routine since my work got a lot more stressful. Before that, I think I was probably drinking about 1 to 2 drinks per week.
And any withdrawal symptoms if you don't drink? Any shakiness or nausea? Any history of withdrawal seizures ever?
No, nothing like that.
Good. And so no alcohol withdrawal symptoms then, it sounds like. And it does sound, though, like you are drinking up to 10 glasses of wine a week, whereas before you were drinking about 2 per week. So we do have data suggesting that more than 7 drinks per week for a woman can put them at increased risk of cardiovascular problems and some types of cancer. The increased alcohol use started a few months before some of these symptoms, and I'm worried that it could be contributing in several ways. Long-term alcohol can worsen depression or anxiety, and it can also disturb sleeping patterns if the sleep we get isn't as restful. Finally, it could be contributing to some of the weight gain, though there are also other factors as well that could be contributing, such as decreased exercise and menopause.
Do you think that the alcohol could actually be making the hot flashes worse?
We have some studies that have looked at that, but so far we don't have any consistent evidence that alcohol increases hot flashes, and people are continuing to study this topic. Cigarettes do seem to make hot flashes worse, which is not an issue for you right now. However, it seems like you have increased how much alcohol you're drinking in response to stress, which may feel better in the moment, but I'm concerned that it could be contributing to the sleep disruption and low mood over the long term. It also may get in the way of us figuring out how best to help you. How hard do you think it would be to cut down for a time while we work to improve your sleep and mood?
I mean, honestly, I don't think it'd be that hard because my husband's been also trying to drink less to lose weight, so we could probably do it together.
I think that sounds like a great idea. So, okay, I have a few more questions to make sure I understand what's going on, and then I'll share some more ideas to make things better. So to summarize, for the last 2 months, you've had poor sleep due to frequent awakenings, often with hot flashes, some weight gain, and you've stopped exercising. Have you been feeling guilty or are not coping well? Oh, you've also been feeling guilty, haven't been coping well, forgetting things and feeling distracting, and not enjoying things on your own. Have you felt so bad that you wished you were dead or wished you'd go to sleep and not wake up, or had any actual thoughts of killing yourself?
I mean, I do have thoughts like, what's the point of all of this? I would have never not wanted to live, and I don't have any thoughts of killing myself, but sometimes I do wonder if it would be easier if I just didn't wake up at all.